30 years ago, physicians, scientists, and philanthropists came together in Houston to create a new type of organization, a center that is dedicated to the research of aging and the treatment of the elderly. The Huffington Center on Aging, as it became known, is now internationally renowned for its expertise in the science of aging and enhancing the lives of senior adults.
So the Huffington Center on Aging started in 1988, and it was a great vision by Dr. Lukey, Dr. Butler, and of course the Huffington family.
I remember the first time we met with them in the president's office. Mr. Huffington and Mrs. Huffington were going to give a substantial amount of money to Baylor, but they didn't know where to put it. We presented our program, Neuroscience presented their program. At the end of that, Mr. Huffington said, "My wife Phyllis will make the final decision."
My grandmother had been in the hospital, I believe, and my mother had overheard another physician making a comment that wasn't exactly positive about elderly people or what their needs were, and that really angered her. And so I think that was one of the things that motivated her or caused her to think about the need that might be out there.
And so the Huffington Center on Aging was created to fulfill the unmet medical needs of the elderly and to better understand why and how we age.
Aging is a little bit different because it's so universal. It's a process that middle-aged people want to avoid the ramifications of, that older people want to embrace and want to improve their outcomes given that it's part of their lives. And so the HCOA became sort of, again, an organizing point, a touchstone.
They focused on breakthrough research, clinical care, and education, but the education was really focused on healthcare professionals. There really wasn't a presence in the community. So in 1997, we decided to start having programs within the community.
Educating the community on aging and age-related diseases became one of the center's main goals. The gathering of these brilliant minds, lay and scientific, in these diverse efforts, launched exciting collaborations nested at the center of this organization.
Baylor is really a fantastic institution for doing science and for collaboration.
The Texas Medical Center is the largest medical complex in the world and the 8th largest business district in the U.S., with over 10 million patient encounters each year.
The medical center has so much to offer. It is really vibrant. So I think if you come to the Texas Medical Center, you would feel this intensity, you would feel the excitement.
We are collaborating very closely with Texas A&M University, with Houston Methodist Hospital. We're working with MD Anderson Cancer Center, with Rice University, as well as with NASA.
Our research has been focused on basic biology of aging and try to understand the fundamental mechanisms on why organisms age.
Research is one of the key missions of the Huffington Center on Aging. Its scientists have a diverse portfolio ranging from studies of simple model organisms such as yeast and worms to understanding complex diseases such as cancer, cardiovascular disease, and Alzheimer's.
To make a fundamental difference, we need to understand the aging process, and we need to apply what we learned in aging and disease research to those elderly individuals.
For instance, when you look at heart disease, high cholesterol increases your risk threefold. Age increases your risk 1,000-fold. So wouldn't it be cool if we could actually tackle this common risk factor? And nowadays we are actually entering an era where we have the chance not just to be bystanders, but to do something about aging.
We rely on research at the basic level because that's where the breakthroughs are going to come. We rely on research at the translational level because we need to translate what's learned in the basic science labs to the bedside. And then we need pure clinical research.
Beyond research, the Huffington Center on Aging forms a network across clinics, extended care facilities, and hospitals, including the nation's largest VA hospital, to provide specialized medical care to older adults. Across all its inpatient, outpatient, and consult services, it reaches thousands of patients every year.
And our clinical mission has expanded dramatically to a robust house calls program that's really a source of pride and joy. We still maintain a good presence at the VA. And then on the private side, we've expanded to multiple hospitals in the medical center, all delivering consult level care to older people who really need us.
There's still a lot we can do in the home that we can't do in clinic. We used to think it was the reverse. We could do so much more in terms of testing. What they need is our astute observation of how they're living, the time we spend listening to what's important to them. It's about working for a goal to keep our patients as independent and autonomous as possible.
Senior patients have unique needs, and educating the next generation of healthcare providers is an integral part of what the Huffington Center on Aging does. This includes teaching medical students, physician assistants, and training seasoned doctors, as well as supporting Texas' largest fellowship program in geriatrics.
And I think the most satisfactory thing that I find would be to recruit the talented people. I think they represent the future of the Huffington Center on Aging and also the entire aging field.
The HCOA is providing the community and the world already with good research, good education, good patient care, and outreach to the community.
The center's slogan is driving science, improving health. What I would like to achieve in the next 10, 20, 30 years would be to build bridges. And one is to bridge the aging with age-related diseases. And the other is to build from science to health.
Working at Aging Center is very personal to me because I made a lot of friends here, and all my colleagues, and talking to them, inspire me every day to think about the question we have been thinking all the time, but from very different angles.
To offer an environment that people feel like they're welcomed, they're supported, and they feel like they can do the best possible science.
And that's the beauty of the Huffington Center. It's home for so many different people approaching aging in so many different directions.
So that's why I think for younger generation, they should come into aging research, and because if they're interested in treating cancers and cardiovascular disorders, and they should just study aging, because when we find a way to deal with aging, then we'll find a way to cure all those diseases at the end.
Join the mission, Huffington Center on Aging, driving science, improving health.